अस्सलामुअलैकुम। अल्लाह आपको हमेशा खुश और अपने हिफ्ज़ व अमान में रखे। In today's video, I will discuss chest infection or community acquired pneumonia in a completely paralyzed or bedridden patient. Chest infection or pneumonia is a common complication in such type of patient. This is first due to because of position of this patient. These type of patient can't change their position. They are always in lying position. They can't change their position to left or right. And the second thing, the respiratory muscles and swallowing muscles in these patients are weak. So the patient can't swallow the food properly, and when some portion of the food goes to respiratory tract, he can't get the portion of the food or fluid out of his respiratory tract because gag reflex and respiratory muscles are in these patients are weak. The third thing, in these type of patients, there is always feeding problem. During feeding, as I said, some portion of the food goes to the respiratory tract, and these patients always have feeding tube, NG tube for feeding. There is problem in the NG tube, leakage, the tube becomes out, and sometimes they get out the tube. The tube is in the mouth or oral cavity, and when he gets food, all the food goes to his trachea, and sometimes position of the feeding tube is not properly placed. So the feeding problem is a common cause for respiratory infection or pneumonia in these patients. Now we will discuss how we can prevent pneumonia or chest infection in a completely paralyzed or bedridden patients. First, we should care their position and properly change our position from left to right, from lying to sitting, and we should keep position of the patient upright, yani head and chest should be upright. We should put something back of their head or chest so that the position of the patient most of the time remain upright. And if possible, we should have a hospital bed for such type of patient, because in hospital bed there is a electric system. We can easily change the position of the patient from chest wise head. We can lift his head, we can lift his hold the bed of the patient from side to side, his lower limbs, etc. If not possible, at least in the home we should put something behind his head or chest, so the patient position of the patient should be upright. This is one way to prevent the chest infection. And another thing, we should take care while feeding the patient. And we should sit the patient in a 90 position, and when somebody is feeding the patient, he should know that the patient is properly swallowing and something is not going to his respiratory tract or trachea. If this is the problem that the patient can't swallow properly, we should pass feeding tube, NG tube. We should feed the patient through the NG tube. And the best thing is the tube in the stomach, PEG, percutaneous gastrostomy tube. This is the best thing. Here in PEG, we pass a tube direct in the abdomen to the stomach. Then these type of patients are fed through this tube, and there is nothing goes from his mouth and esophagus to his stomach. So this area always remains safe. So he has less chance of pneumonia or chest infection. And the last thing, in such patients, these patients are all elderly, they are bedbound, so we should give pneumococcal vaccine to prevent the pneumonia in these patients. How to know that these patients have pneumonia or chest infection? When the patient gets chest infection or pneumonia, he starts coughing. Sometimes the cough is dry and sometimes there is sputum, and he has breathing problem. His breathing becomes shallow, difficulty in breathing, and sometimes the patient gets fever, and his oxygen level in the blood goes down. How we know that oxygen in the blood is less? There is nowadays very simple machine, pulse oximeter available. We put this pulse oximeter to his finger, it will tell us that how much is oxygen. It should always be more than 90, up to 100 this is normal. If less than 90, the patient oxygen is less. And sometimes the patient blood pressure drops. These are the symptoms and signs of pneumonia in every patient, but especially in these patients. Coughing, shallow breathing, fever, low oxygen, low blood pressure. And sometimes the patient sense becomes changed. He is confused, disoriented. So these are some of the signs we can recognize that this patient has chest infection or pneumonia. When the pneumonia or chest infection is mild, we can treat in the home by advice of the doctor by oral antibiotic. There are different types of oral antibiotic, macrolides, fluoroquinolones. These are commonly used. In fluoroquinolones, moxifloxacin, levofloxacin. In macrolides, azithromycin, clarithromycin, etc. When the pneumonia chest infection is more severe, the patient should be taken to the hospital. There he will get IV antibiotic in combinations. And the pneumonia is more severe. Patient has more high fever, difficulty in breathing, he is confused, his oxygen is very low. He should be admitted in ICU. There he will get combination of antibiotics, third generation cephalosporin plus fluoroquinolones, azithromycin, etc. This was about something about the chest infection or community-acquired pneumonia, which is a common complication in completely paralyzed or bedridden patient. Please like this video, comment, and share. Thank you.